At the moment, the world is threatened by the pandemic named as COVID-19. This is a project done to promote the information given by the World Health Organization to ensure the awareness of our community regarding the steps taken by the United Nations for this crisis. In this video, we will be looking at Part 5 of the COVID-19 calendar, from the 13th of March 2020 to the 20th of March 2020. On March 13th, a new COVID-19 Solidarity Response Fund started to raise money from a wide range of donors to support the work of the World Health Organization and partners to help countries respond to the COVID-19 pandemic. The fund, the first of its kind, enables private individuals, corporations, and institutions anywhere in the world to come together to directly contribute to global response efforts, and has been created by the United Nations Foundation and the Swiss Philanthropy Foundation, together with WHO. On the same day, it was reported that Europe now has more cases and deaths than the rest of the world combined. Apart from China, more cases were being reported every day than were reported in China at the height of its epidemic. With hopes of minimizing the spread of disease, WHO launched the Safehands Challenge to promote the power of clean hands to fight the coronavirus. To support the challenge to encourage people to clean their hands with soap or alcohol-based hand rub, Twitter created a new hand-washing emoji. Heads of state, footballers, singers, and more have already taken part, with more people nominated to join the challenge every day.
One of the most important is regular, safe, and effective hand hygiene, using soap and water or alcohol-based hand rub.
On March 16th, it was advised that countries should test every suspected case of COVID-19. If people test positive, they should be isolated, and the people they have been in close contact with up to 2 days before they develop symptoms should be sought out, and those people should be tested too, if they show symptoms of COVID-19. WHO also advises that all confirmed cases, even mild cases, should be isolated in health facilities to prevent transmission and provide adequate care. But it was recognized that many countries had already exceeded their capacity to care for mild cases in dedicated health facilities. In that situation, countries should prioritize older patients and those with underlying conditions. On March 17th, the World Health Organization called on member states in Southeast Asia region to urgently scale up aggressive measures to combat COVID-19, as confirmed cases cross 480, and the disease claims 8 lives. On March 18th, real-time training during global emergencies is critical for effective preparedness and response. The massive online open courses for COVID-19 provide learning resources for health professionals, decision-makers, and the public. More than 320,000 learners have already enrolled. As the pandemic continues to evolve, new resources will be added, additional language versions will continue to be rolled out, and existing courses will be updated to best reflect the changing context. The coronavirus pandemic is a crisis unlike any in the UN's 75-year history. During his press briefing on COVID-19, on March 19th, UN Secretary General Antonio Guterres asked world leaders to come together and offer an urgent and coordinated global response. On March 20th, 2020, to increase access to reliable information, WHO worked with WhatsApp and Facebook to launch a new WHO Health Alert messaging service. The WhatsApp-based service will provide vital information about COVID-19 to millions of people through their mobile phones. The service uses an AI chatbot to provide updated information on the pandemic, including how to protect yourself, questions and answers, and the latest news and press coverage. The Health Alert service is now available in English and will be introduced in other languages. This is part of WHO's wider initiative to work with technology companies to get accurate health information into the hands of people that need it at this critical time. This brings us to the end of the presentation. Thank you for watching and keeping up with our program. You can access more information on the official websites of the United Nations and World Health Organization. Until we meet again, be sure to keep clean and stay safe.